And that was Molly Shen reporting. All right, here at home, a groundbreaking medical procedure done right here in Kern County, capturing the nation's attention. It's called the VenaSeal closure system. It helps people with lower leg veins that have stopped pumping blood back to the heart. Dr. Vinod Kumar from the Vascular and Leg Center is here to talk more about this procedure. Dr. Kumar, thank you so much for being here tonight.
Oh, thank you, Anna.
Well, this is very exciting, especially for you, because you were the first doctor in California to perform this procedure and the second in the United States.
That's right, and what this procedure is, patients who have bad varicose veins. See, varicose veins affect about 30 million people in the United States. That's 10% of the population. And these varicose veins, if they get inflamed with time or get dilated more and more, they do not pump the blood back up to the heart. And so this becomes like a hole, a pool of the blood that's sitting in the legs and feet.
And that's not good.
And that's not very good, because this is the bad blood that is sitting in the legs, and it starts irritating the skin. You start getting itching, getting pain, heaviness, restless legs at night. You start becoming, if you itch the skin, this becomes an ulcer that does not heal. So these veins can become very significant medically in these patients, who can then develop eventually blood clots and may need amputation eventually.
You brought this diagram here to talk about varicose veins for people out there who aren't familiar. Can you show me? You were talking about it earlier. It's very interesting.
Right. See, there are many veins in these legs, that carry the blood back up to the heart. There are arteries that bring the blood down, but the veins have to bring it back. But this blood has to travel against the gravity, and these valves hold the blood in the veins. If the valves don't function, then the blood goes up and down, and by the evening all of it collects, and then legs can become like this. Look.
Okay, so let's talk about VenaSeal. It's so great, such a great procedure, non-invasive, which is the major thing, right?
That's right. What it is there's no need for anesthesia, there's no need for any sutures, there's no need for any hospitalization, no need for stockings afterwards. It's a very simple procedure, so you can get it done during your lunchtime, go back to work.
And you've done 2 of these, right?
Well, we have done 2 of them, very successful. This patient, the first patient we did, actually said he's going to go dancing. He started dancing right in the office, actually.
Oh, how long does it take?
Takes about less than 30 minutes.
Less than 30 minutes. So you say previously, if people had to get this procedure done, it was actually, a hospital. So here's a video, by the way, of it being performed.
Yeah, see what it is this is done right in the office in a setting which is outpatient totally. The patient used to get a big procedure before. It started with the vein stripping, which is 5 days in the hospital and big scars. Then we started to do the radio frequency and laser ablations. That also requires some anesthesia and stockings afterwards. But this one is just purely come in and go out procedure.
Wow. Yeah, you could see him up talking. No problem.
Yes, actually, I don't know if you captured the first patient. He was laughing during the procedure.
Laughing. So not as painful, right?
No, not at all. Actually, very minimally painful and minimally invasive.
So who is the ideal patient?
The ideal patient is anybody who has varicose veins. They have the pain or swelling in the legs. Then most of the patients with varicose veins are ideal patients for this procedure.
Okay, so if people out there want to get more information on this, how can they do so?
Well, they can call our office at 324-4100.
Okay, 324-4100. Okay.
And we can get all the information to them.
Okay, Dr. Kumar, thank you so much. This is so exciting for a lot of people out there. And congratulations on being the first one in California, doctor, and the second in the United States to perform this.
Yeah, thank you very much, Aaron, for having us on the air.
Well, Dr. Kumar, thank you so much. We'll see you soon.
You're welcome.